Good morning. My name is Dr. Sanjay and I'm a student of University of New England taking Pathophysiology course 1030. Today I'll talk about diseases and the types of diseases and the etiopathogenesis and diagnostic treatments of diseases. So what is a disease? A disease is an abnormal condition which affects the normal structure and function of our body. It can also cause alteration and defects in our homeostasis. So, for example, if we want to take a disease, we mean anemia. Anemia means it's an abnormality in the red blood cells, meaning that there's low amount of RBCs. Or if we take pneumonia, what is pneumonia? It's a chronic inflammatory condition of the airway sacs that affect both the lungs, and it is affected by various different microorganisms, including bacteria, viruses, etc. So how do we classify diseases? Diseases are classified as communicable diseases and non-communicable diseases. Communicable diseases are diseases that can be spread from one person to another person. It can be spread through cough, droplets, getting exposed to infectious blood, etc. And such example of such diseases are chickenpox, COVID, hepatitis, etc. An example of non-communicable diseases are not spread from person to person. Instead, it happens from abnormal conditions that affect the normal homeostasis in our body. For example, diabetes mellitus. Diabetes mellitus is a condition where you have abnormal high amounts of blood glucose. Or if you take hyperparathyroidism, this is due to excess amounts of PTH, which leads to increase in the normal serum calcium levels, which could also cause other symptoms like CKD or any chronic kidney disease, etc. So this is the classification of diseases. Now coming to the etiology. What is etiology? Etiology is the cause of the disease. So when we talk about tuberculosis, what is it caused from? It's caused from an acid-fast bacilli called Mycobacterium tuberculosis. Or if we talk about chickenpox, chickenpox is caused by a pox virus. If we take diabetes, it could be caused due to insufficient amount of insulin that is produced. So these are all the etiological features that cause diseases. The next point I'd like to talk about is the pathogenesis. Pathogenesis is the mechanism of the disease. So if we take the pathogenesis of diabetes, we look at how it occurs and what are all the different mechanisms that lead to it. So in type 1 diabetes, it is due to it is an autoimmune disease where all these antibodies, they attack and they destroy a cell in our pancreas called as the beta cell. These beta cells are responsible for secreting insulin, and there are two types of cells in the pancreas. One is the beta cell, which secretes insulin, and the other is the alpha cell, which secretes glucagon. So once these autoantibodies, once they destroy these beta cells, the insulin is not produced, and since insulin is not produced, we see high number of blood glucose. In type 2, it's pretty much the same, but you have insufficient amount of insulin. The insulin is not completely destroyed. It's just that it's not being produced in a certain amount. So these factors cause our body to have increased raise in blood glucose, which leads to diabetes. Now, what are the complications of diabetes? So diabetes could have multiple number of systemic complications like diabetic retinopathy, nephrosclerosis, or atherosclerosis. We could have heart issues. So it could have multiple different type of side effects, and these are all the complications of diabetes. The next thing I'd like to talk about is a symptom. What is a symptom? Symptom is what the doctor elicits. So if a patient has fever, fatigue, weight loss, whatever the patient complains, these are all subjective. This is the symptom. Also, we also have another thing called a sign. Sign is what the doctor elicits. For example, in anemia, we look at the lower part of the conjunctiva, and then we notice that we have pallor. So this is a sign of anemia. Or we could see cyanosis, clubbing, which is a bulbous like enlargement of the lower fingers. These are all signs that are elicited by the doctor. So the next thing is a diagnosis. Seeing all these things, how can we diagnose the disease? Diagnosis, we could see the diagnosis through the symptoms. For example, if you have a patient who has severe weight loss or excess blood or bleeding or weight loss, we could diagnose this patient as a malignancy. Or in hyperthyroidism, if we have weight loss, heat intolerance, excessive sweating, we could calculate this as a hyperthyroidism. And hypothyroidism is excess cold, weight gain. So this is all ways that we can diagnose. So diagnosis is we diagnose the patient by seeing the symptoms. The next thing that I'd like to talk about is the diagnostic tests. There's variety of diagnostic tests that are available, which is PCR, ELISA, and ESR. So these are all methods that we could use to diagnose a certain condition, and they're all commonly used in the clinical setting. Now I'd like to talk about a syndrome. A syndrome is a set of symptoms that leads to a condition. So when you talk about Down syndrome, we see multiple different conditions. For example, we could see congenital heart defects, we could see facial abnormalities, we could see intellectual disability. So all these symptoms, they combine together and then we form a syndrome for this patient. So syndrome is nothing but a combination of multiple symptoms combined together, which we could see in a patient. And then the last thing that I'd like to talk about in this video is the prognosis. So prognosis is the progression of the disease. For example, if we have a patient who has an ankle injury, well, obviously he'd be having a prognosis of 6 weeks until we could finally remove the cast. So the prognosis is the course of the disease, and it is how the disease progresses gradually from time. So this is all about my video. I hope you like it, and thank you for watching.